Good afternoon. This is Dr. Larry Kidd being on Facebook Live with you again today. And I am joined by Dr. Cecelia Hann, whose specialty at our hospital is OBGYN. Dr. Hann is a leader, a medical staff leader at our hospital, and she has previously served as Chief of Staff here at Henry Mayo Newhall Hospital. So we're very pleased that you are joining us again this afternoon. And just to remind you, our next time for viewing will be on Monday afternoon. So we've had a few questions to come in specifically addressing areas of specialty for Dr. Hann. And we will start off with a question that was submitted from one of our viewers. That question has to do with whether or not there have been any pregnant women who have tested positive and what the effects on the women has been. Dr. Hann, thank you for being with us today.
Of course. Thank you, Dr. Kidd. I appreciate you asking me to join you today. So happens that there's been very recent article out of Lancet. It's a very reputable journal. They described 9 pregnant women out of Wuhan, China, and they delivered 9 infants. I just want to expand a little bit, pregnant moms and their infants. I think that's the part that we cannot forget. Both mothers and infants have done well when they were, compared with APGAR scores and outcome. So I would say with very limited information worldwide, it appears pregnant women and their infants seem to be so far okay. With a lot more cases coming up, we will probably have a lot more information, but that's all we have so far to tell you.
Okay, thank you, Dr. Hann. We had a couple of questions related to how are we managing at the hospital in terms of have we been able to accommodate all of the patients who are presenting at the hospital, whether or not some of the units that previously weren't being used at the hospital, if they have been opened. We actually meet on a day-to-day basis based on patients presenting to the hospital. We determine the need to expand. So we have opened additional beds at our hospital. We are also working to ensure that we have the ability to take care of critical care patients. As we previously discussed, some patients that become ill as a result of contracting the coronavirus require mechanical ventilation. So in the news media, you see a lot about the shortage of ventilators, those kinds of things. And again, today I'm pleased to report that we have adequate supplies, personal protective equipment. We have adequate stock. As well as we do have adequate mechanical ventilators in order to support patients that require that level of care. So again, on a day-to-day basis, we'll evaluate the need, and we have the capacity to expand the hospital beds quite a bit. Another question for Dr. Hann. Has there been any pregnant people with COVID-19, and are they okay?
I think I already might have touched upon it with the first question. Those 9 cases that reported seems to be okay. I think we just need to wait a little longer and get a little more data. But according to the American College of OBGYN, they seem to be okay. I just wanted to piggyback on what Dr. Kidd said. Indeed, we are very, very fortunate. We opened a brand new tower for women, and we are well prepared for, in the event that pregnant women have contracted or at risk for contracting COVID-19 virus infection. We have special rooms on Tower 5 that are negative pressurized, and we have full equipment for these patients. So we are extremely fortunate, at very difficult time indeed, to be fully prepared.
Right, and as Dr. Hann indicated, we did just open a new tower, and our women's unit is a beautiful facility and as indicated, quite well equipped to handle patients that present routinely, and then those that might have contracted the virus. There was a question that came in related to whether or not an infected child could have the flu and the coronavirus at the same time. To my knowledge, for adults, for sure, there doesn't seem to be a contaminant. It looks like the patients that test positive for flu are not also testing positive for the coronavirus. That is the experience. Dr. Hann, I'm not sure if you're aware if in children if there's any difference there.
Once again, the data is very lacking in that department. But when they tested those infants born to the mothers who had COVID-19, they all tested negative. So surmising from those 9 cases, I would say they do not seem to be infecting their infants. Having said that, I just want to say, according to American College of OBGYN, they strongly recommend pregnant women to get influenza vaccines because protecting mothers, the pregnant women can also protect their infants. If I could just spend 1 second about expanding that information about the infants. If a mother is tested positive for COVID-19 and if she delivers, she will be separated, the infant will be separated in a different room. They will not be rooming together. And we are following CDC guidelines and American College of OBGYN guidelines. All care will be taken to make sure that we use proper CDC guidelines to protect her and our staff and the infant. And in terms of, I think one of the questions that may have come up, how do we handle nursing, breastfeeding? We always encourage babies to be breastfed. In this case, however, we encourage mothers to pump with a mask on and always washing her hands and using all the proper equipment that's very sanitized. Then the nursing will generally feed the baby and not the mothers. And that's according to latest CDC guideline. I just wanted to put that out there in case you had that question.
Thank you, Dr. Hann. Another question that came in has to do with how does one monitor at home? If someone tests positive for the coronavirus, who is checking up on the infected person? So in that regard, previously discussed that there's a screening process that takes place to determine if individuals meet criteria in order to be tested. Should they be tested, there's a positive test, and should they be discharged to home to self-quarantine until that test comes back. There's some specific instructions that the CDC has published related to monitoring or self-monitoring, that is, at home. So one of those things is to check one's temperature at least twice a day. Of course, upon any advance of symptoms, new symptoms, the individual is encouraged to contact their primary physician or healthcare provider to follow up with them, and they will provide further directions. And of course, if their condition advances, they would be directed, if they're having what they consider a medical emergency, then you would, as with any other medical emergency situation, call 911. But again, the key would be to follow up with one's physician or primary healthcare provider for further follow-up. Individuals who test positive for the coronavirus, their information is submitted to the county health department, and there are individuals that do surveillance and follow up with them and to determine that they are progressing, and if there are any other follow-up that's required by the health department, that is done outside and apart from the hospital. Dr. Hann, we had a question that came in regarding protecting other patients, other women who might be in labor, that they didn't test positive. what precautions might be taken for them while they're in the hospital? Are they isolated? That sort of thing.
In general, at our hospital, we do not isolate patients unless they are COVID-19 positive or they're at extremely high risk. But the rest of the patients, we always use precautions that's universal. Washing hands before you enter the room, after you touching anything, after touching the patient, and upon exiting, we always wash hands. That is, I think, paramount to universal precautions. And if there's any respiratory element, then we always wear a mask. Regular surgical mask seems to be that is indicated right now by CDC. Having said that, I think it all teaches a lesson that we all should wash hands at all times. And that's what we can do for everyone, whether you're at risk or not. But those at risk are in particular separation. We have separate units for them. And I think I already touched upon what we do at our hospital.
Thank you. Just to follow up to that, Dr. Hann, are the patients allowed visitors, is what one individual requested to know about.
Of course, of course. Right now at our hospital, we allow one visitor, and we do not switch them back and forth. That person is usually screened before they come in, and that person is allowed to visit throughout the day, and only one person is allowed. Departure from what we normally do, but the times are different.
Okay, we're coming to a close of our session today. Dr. Hann, any last thoughts or suggestions, recommendations for our viewers out there?
Well, just one, that pregnant women in general are slightly higher risk for any respiratory infections, and that goes for influenza, and then before it was SARS, before it was MERS, all those things, respiratory infections. And this one is no different. So we are taking precautions to take care of pregnant women even better than before, hopefully. And they can wash their hands always and take precautions. As the CDC says, social distancing, that's paramount to how we're going to combat this.
Right, and with that, we'd like to close out our session by reminding our viewers about our blood drive. Keeping in mind, as we reported a couple of weeks ago, the nation's blood supply is very low during this time. There are precautions taken for screening individuals that come to donate blood. All of the safety precautions are taken to ensure that both those who are providing the services and the individuals who are donating blood, they're kept safe. And we do encourage you to please consider donating. We'll provide you with the details of that on our website, as well as at our next viewing. We'll give you more specifics about that drive next week. We'd like to thank Dr. Hann for joining us today. And as you've heard, patients in our care at Hann Mayo are in good hands, and Dr. Hann is one of those physicians that provides that care. So again, thank you for viewing today. Thanks for joining, and we hope today's session has been beneficial. Do take care, everyone. We will see you next week.
Thank you, Dr. Kim.